Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon, Dr. Alfred Bonati. Exciting show just waiting for you. Let's get right to it. Now, much of what we know about women's bodies and health has come from men. But a new book written by a medical historian is looking to reframe those outdated narratives. Joining us to discuss is Dr. Elizabeth Comen, Memorial Sloan Kettering oncologist and author of All in Her Head. Thank you for joining us on the program.
Thank you for having me.
All right. Well, you really did a lot of exhausting research for the book. Can you tell us how the idea began and really what that process was like?
Sure. Well, as you mentioned, I'm an oncologist and I've taken care of breast cancer patients my entire career. And I really was just so motivated and inspired by the stories of so many patients, not just about the cancer that they were struggling with, but many of the health journeys along the way where they were misinformed or misunderstood or felt blamed or shamed about their bodies. And I felt compelled to really unpack this legacy that I think so many of us inherit when we show up at the doctor's office.
As a female in the medical field, I mean, what did you want to, I guess, open the eyes of readers to?
Well, in some instances, the history of our American medical system was originally built by men, and women were not allowed to go to medical school, and many midwives were sidelined. But there are many women that are in medical school today. My graduating class at Harvard Med School had more than 50% women. And the book is really not to say that men can't be extraordinary caregivers as well. It's really to say, how can we level the playing field? How can we make up for so many of the gaps that we know exist in our healthcare system today, where women's female predominant diseases or diseases that are unique to women have largely been misunderstood or not really researched in the same way.
And what are some of those pathologies that are, specific to women? And why do you think those things are frequently misdiagnosed?
So many different things. Well, I mean, 80% of autoimmune diseases are in women. And in many instances, we don't even consider that a women's health disease. When I think of women's health, what I learned about in medical school, I think of gynecology, I think of breast cancer, but I don't think of some of these other issues, like also that heart disease is the number one killer of women. And yet many of us in the lay public and in the doctor world think of chest pain in women as atypical and the way that they might present with heart attack symptoms as atypical, but we're, as you said, greater than 50% of the population.
And the title of the book, All in Her Head, I mean, once you delve into what you're talking about here, I mean, that's probably something, it probably goes back to the whole hysteria diagnosis, right? It's all in her head. She's just a crazy woman over there. Is that kind of what you're trying to convey?
Maybe we really are crazy, but if you go back in history, the word hysteria derives from the Greek word for womb. And this specter or the ghost of the hysterical woman really plays out through much of Western medical thought, including in recent years. It wasn't until the 1980s that hysteria or hysterical was removed from the lexicon of a medical diagnosis. But we still see that play out where women are told, oh, you're just anxious or calm down or you're going to be fine. And unfortunately, this title has really struck a chord with so many women. When I've spoken across the board, many women will tell me stories that they have been told that it's all in their head, when in fact something more insidious was going on.
Not so much about my own health, but I remember when I had my daughter and we had an emergency with her, and I was trying to point out so frantically to the medical staff, my child is yellow and blue on the bottom, yellow on top. And oh, you're a new mommy. Go home and rest. And then it turned out she had jaundice and heart issues. And it took just kind of a passerby medical staff to come in and go, oh my God, this baby's yellow and blue. And I was like, you're right. Finally, somebody could hear and validate, but the rest played it off. And it is disheartening to women that is something that a lot of us have put up with in the past, and it shouldn't be the case.
I'm so sorry that happened to you and your baby. And I think what you're really speaking to is the sense that we all should have the experience in our medical system where we're able to trust our gut and go with our instincts. We know our bodies better than anybody else. And we want to be able to partner with medical professionals who have, their decades of medical knowledge, but to really have that relationship where you can say, something is not right. I don't feel right. I'm coming to you as a trusted professional to help me understand what could be going on and or reassure me that I really am okay.
You talk about some condition called chlorosis. that apparently often affected young women throughout history. I've never even heard of that. What is
I know,
chlorosis?
fascinating, right? So at the turn of the 19th century is really when this diagnosis of chlorosis was just everywhere. And it was almost every adolescent girl, every young woman had it. And it was this fascinating diagnosis that in retrospect was probably related a lot to just iron deficiency anemia. But it really shows how much medical conditions can be infiltrated by culture, society, religion. This was a situation where at the turn of the 19th century, many women were thought that they couldn't have red meat, that they needed to appear dainty, that fainting, beautiful Victorian woman. Well, a lot of these women were actually just suffering from a form of iron deficiency anemia that they were calling chlorosis at the time. Not to mention many of them were wearing, corsets that they couldn't move around in.
Not so much nowadays, but plastic surgery tended to be associated with women. But you point out that the actual origins was on the battlefield. Can you elaborate on that?
Yeah, so it's really interesting. And I didn't know this till I researched the book. But the history of plastic surgery was born on the battlefields, where there was a rise of worse weaponry, the catastrophic facial disfigurations, as well as amputations. And at the same time, the rise of new theories of germ theory. We knew what was causing infections, but equally so that we could operate on people without causing them pain, right? We had anesthesia. Before, we would have to do amputations, within 30 seconds and just cut a limb off. But now you could operate and the person wouldn't be in pain because of anesthesia. But that opened up a whole other world of the healthy patient coming to a doctor to say, well, I don't like the way my nose looks, or I don't like the way my face looks. They're otherwise healthy. But out of these reconstructive surgeries from the battlefield came a whole new field of the ability to alter a potentially healthy person.
There was some talk about women being less evolved. Can you elaborate?
Of course. Throughout history, whether we're thinking about Charles Darwin or the concepts of evolution, there was a tremendous influence of these figures and thought leaders in the idea that women were more primal. And this, of course, was even worse for any minorities or Black women. The idea that we were more primal, less evolved, less intelligent, potentially even more stooped over. That's why we got scoliosis in our backs. And that the white male was the most upright, the most evolved, and the most intelligent. And you can see that play out in pictures of skeletons, concepts of intelligence in medicine, who could even go to medical school because our minds were not as evolved and capable. I would say, that the playing field is there for all of us. And the real purpose of writing this book and the mission was that we have equitable care for everybody. Whether what sex they are, where they come from, what minority they may or may not be, what their religion may be. This idea was really to just show who built the system that we're in and how do we use that information to build a more equitable future.
Any parting words maybe for females who are a little intimidated by, by going to see a doctor that's a male, or I think you get into that a little bit in the book. Is that right?
I think lots of people have health anxiety. One of the things that I always say is bring a friend with you, bring a family member. If you're worried with a new diagnosis and you're anxious, come prepared with questions. Bring somebody with you to help you be an advocate, and recognize that most people who go into medicine really are there because they care, they want to partner with you, and they want to help you access better health.
That's great information. Thank you so much for being on the program, Dr. Elizabeth Comen. Thank you for
having
your
me.
insight. Make sure you stay tuned. We'll have more after the break. You're watching American Medicine Today.
The loss of coordination in my legs, I'd trip over my feet, end up flat in the concrete. Dr. Bonati to me was God sent. Walk like that in a while. I don't remember how long. I didn't have to make a massive lifestyle change. I noticed today that I could sit and stand up without a cane. I would have to give it excellent and above my expectations.
Visit AskBonati.com. Fred was a guest of the Bonati Spine Institute over 9 years ago. He's an active man that enjoys gardening and going to the gym.
I'm in real estate. I own several shopping centers. I buy properties and just doing like that. I used to be in a furniture business a long time ago. I used to import from Far East a lot of different furniture to US, and I sold it here. But I did that for around 10 years. I sold my business. I'm more in real estate business now. I was doing playing soccer before when you play soccer and you get hit, different players, just at the end of the, just the old age, it come back to you, everything, all the problems.
Nearly a decade ago, Fred noticed an escalating pain in his lower back, making it increasingly difficult to walk and work.
I used to have a pain on my lower back, and I couldn't just really walk that much. Right there on my hip, it just stayed there. But sometimes I had a very sharp pain, just it comes and goes. In my business, I had to travel a lot to overseas, and it was difficult for me in the plane because with the pain. When I was sitting or standing up for a while, and the pain was there. When I was sitting, after standing up, when I was sitting, the pain was going down a little bit. And I had to take it easy. Sometimes I have to lay down, and the pain goes away because I didn't have no pressure on it. It was zero gravity when you lay down. And but I couldn't deal with it. Yeah, I could walk or stand up 10 or 15 minutes. I had to sit down after that. If I was standing for 15 minutes, I had to sit down. Or if I was walking, I had to do the same thing. I have to sit down just to let the pain goes away.
Fred sought help from a chiropractor, but quickly came to the realization that the pain relief he got from those treatments didn't last.
First, I started with the chiropractic. I went to a lot of chiropractor. Didn't work, didn't do the job. They give me some device, just to put on your back and just pump it. Those didn't work, because if the problem is physical, you have physical problem, you have to go take care of that. It wasn't just like a muscle, just inflation of the muscles or anything else.
Fred learned about the Bonati Spine Institute from a friend and started doing his research.
He's a very good doctor, but I researched myself about him. I read a lot about it, I find out he's a very skilled doctor, very professional. He knows what he's doing.
Based on what he learned, Fred decided to schedule an appointment for an in-person evaluation. During that examination, he had updated X-rays and MRIs performed at the on-campus imaging center.
I had my imaging, but I had to take it there too. And I saw just Dr. Bonati because it was just like I went to him straight.
Later that same day, Dr. Bonati met with Fred to review his images and outline a surgical plan which included 2 targeted Bonati spine procedures at the L4, L5, and L5S1 areas in his lumbar spine.
He was showing me just where is the problem on lumbar 4 and 5, and my disc was bad in that area. Before I do some things myself, I just do a lot of researching myself. I trust myself first with my own knowledge, but when I went to him, he had super knowledge on that field, and just he educated me. He said, just this is the thing you're gonna do. And I listened to him, and that was a great advice from him.
The exclusive Bonati spine procedures are performed incrementally using conscious IV sedation. This technique allows the patient to remain awake and communicating with the surgeon, ensuring their source of pain is eliminated before they leave the operating table.
I was awake. I was looking at the monitor myself too to see what is he doing, but it wasn't that bad. And just he was talking to me during the surgery, and it took probably like a half an hour, something like that. He knew what is he doing, the back surgery, you just don't give your back to any doctor. You have to give your back to the doctor, he knows what is he doing. And you don't find too many doctors, surgeons like him. And I feel so good. I really feel so good.
An additional benefit to the Bonati spine procedures is they dramatically reduce the risk of infection and blood loss, and it allows for the body to recover faster because the incisions are smaller than those of traditional open back surgery. Because of this, Bonati guests are often surprised that they can return back to work in their normal routines in just a matter of days.
After surgery, I had for a couple of days, just wasn't 100%, just because, after surgery. Actually, I went back to work probably the next day after that, After that, I went back to my normal life and to gym, just did slowly exercise on my back area because I didn't want to hurt myself. But I went back to normal.
Following surgery at the Bonati Spine Institute, guests are instructed to walk at least a few minutes every day to aid their bodies in the healing process.
And after that point, I was fine. I was I said just, he did like a miracle, for me. I felt good. I really felt good.
The Bonati Spine Procedures offer lasting relief, allowing the body to retain its natural mobility and flexibility.
It's been around 9 years. And I really I love going outside to gardening. I just love nature. And before I couldn't bend over just to pick up some weeds or do something, But now I feel really good.
Now, 9 years later, Fred is still living pain-free and highly recommends anyone suffering from neck or back pain to contact the Bonati Spine Institute.
When I advise anybody is having this problem, just go for it. Just don't hesitate. Because if you lose your quality life, it's hard to survive. If I cannot go to gym, five times a week, if I cannot travel, I cannot go here, there, I don't have my quality life. I want to thank Dr. Bonati, and God bless him.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Roku, Amazon's Fire TV, Google Play Store, and Apple's App Store. Welcome back to American Medicine Today. I'm alongside Dr. Bonati, and we're going to be talking about genetics as it relates to aging.
Genetics start to look at certain genes that they are specific related with these situations. Mm-hmm. And what is amazing, just in the last few months, a research obtained information about a type of a factor that is a regenerative factor. And what it is, this factor is a serum. It's being called SRF, is serum response factor. And why response? Because what happened is they are trying to see what create a response in the transition, for example, of a brain that give an order to move a leg. Mm-hmm. What happened? And they start to see areas and localized areas on the brain that they are responsible to do that. And then they went deeper and they found cells that they are neurons that they have then the connections to be able to produce that mechanism or response.
Okay. And when you talk about this serum, is it something that is topical? It's something that's introduced to the body in a pill, in a shot? How are they doing that?
This is just only a type. Right now is a gene that is going to be now creating this type of a knowledge. And once we identify the gene can be manipulated. But this serum response factor did something enormously valuable. Discovered that is the type of a gene or trigger genes that they are going to create an action on the oligodendrocytes.
And what is that?
Oligodendrocytes are cells that they are in the brain.
Okay.
And those cells, they are in the nervous system, in all the nervous system. But these oligodendrocyte cells on the brain, they are coated with a coat. That coat is being called myelin. And the myelin is the one that protects the nerves to be able to do a transition of the information. For example, if you create a system that will increase the amount of myelin in the cells, and those cells are going to protect the axon. The axon are the wires that they go from one side to the other one, and those wires are the nerves. Mm-hmm. So these wires that they go from the neurological cell and they go to in a specific area, they need to be coated with this myelin. And if that happens, the myelin will go between 25,000 to 50,000 thicker in coating these nerves.
Is a thicker coating meaning that it would bring about a younger type of aging? You would kind of age backwards or be younger?
The coating will produce something different.
Mm-hmm.
The coating will allow you to have a response to what orders the brain is giving to your body, and the response will depend on how fast that goes. When you have a myelin that is not strong enough or has breaks or has areas that they are not really with myelin on the nerve, you have a leak of information. So if you have, for example, a thought, and then you're thinking something, and then suddenly that thought is being interrupted because leak. So you cannot complete your thought.
So it seems to me that this would help those that are suffering from dementia and Alzheimer's.
Well, imagine that if somebody already had a problem without being able to communicate, the actions of the cells are being interrupted, so they cannot do the transmission. But if you seal the area, then you will have immediately the transmission regenerated. And if that happens, the possibilities are practically controlling all the neurological diseases, controlling and practically making disappear totally Alzheimer's. The enormous discovery that happened in these last few months is the fact that the researchers identify a serum response factor. And this serum response factor is so amazing that it's going to increase the thickness of the myelins. Once you increase, will irritate the oligodendrocytes, and the oligodendrocytes, that they are the cells that they produce the myelin, will now recoat the nerves. If that happens, you are not going to age. Because what really aging is a lack of communication. Aging is a lack of feeling. Aging is a lack of motor actions. So when you look at the young person, is agile. When you look at the young person, the thoughts are fast. When you teach a young person, immediately the person captures the knowledge. But if the person cannot do that, then you start to lose that leak that I'm saying. You start to have less thoughts, less recognition of things, and less sensation. Sometimes you are numb.
We're going to take a quick break. We'll be right back, continuing the discussion on genetics. You're watching American Medicine Today.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
We went to the Bonati Institute, and that was the turning point in my life. This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
This is the honest to God truth. And was recovering, I didn't feel anything. The pain that I was suffering is gone. I can go back to work in like 3 days.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, you know? So 6 days, and everybody wasn't all like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay, let's see how you do. And I was bowling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine. Today, we're continuing the discussion about myelin sheathing and how it affects genetics. So, Dr. Bonati, you were talking about how when you start to kind of age backwards or don't age, it's because that myelin sheathing is thicker. So why don't you continue?
When you are in an old person, your thoughts are confused sometimes. Your memory fails. Your muscles become not as strong as in the past. You have difficulty walking. You lose your balance and you have falls. All these things are contributing because that myelin that we said in the other conversation is now fading out, and the oligodendrocytes cannot produce that material. Now we have in our repertoire of study the serum response factor. And this serum response factor will irritate and create an action on the oligodendrocytes. And then if those ones will now create myelin, the myelin will now seed again around the cells. The myelin is nothing more like a type of a fatty sheet. But this fatty sheet is protecting the axons. And if the axons are being protected, then the transmission of the information is very fast. Faster the transmission, younger you are. Aging will be practically a history. We will be able to correct aging by God knows how far.
Well, it just seems like technology is advancing so quickly nowadays that it's hard to comprehend. And it seems as though the fountain of youth is part of that serum, that factor serum you were just speaking about. And of course, we'll continue to track that on future episodes of American Medicine Today. Thank you for watching, and you can find us anytime, anywhere if you download our app, keyword AMT and keyword Bonati. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.